episode of Health Education Series with Nurse V. Today we'll be talking about prostate enlargement. The prostate gland, which is this gland here, is an accessory gland of the male reproductive system. It is located just below the urinary bladder. This is the urinary bladder. And it functions in secretion of a fluid that helps to nourish and protect sperm. Now, another function of the prostate gland is that during ejaculation, the muscular action of the gland helps to propel semen during ejaculation. The urethra, which is a tube that drains urine from the urinary bladder to the penis where it's expelled, passes through the prostate gland. So if there is an enlargement of the prostate gland, the pipe, the urethra, will be narrowed or even constricted. So it's quite difficult for urine to drain from the urinary bladder. So when this happens, there's restriction of urine flow. So urine is retained in the urinary bladder, which is a risk for development of infection to the bladder. There are varieties of symptoms ranging from urgency, that is the quickening one has to urinate, hesitancy, there's a delay before one is able to urinate, frequency, that you urinate quite frequent, especially at night, painful urination, thinning of the urine stream. For example, when you open a water tap, it flows freely, but when you try to lock it, the more you try to lock it, the thinner the stream of the water is. It's same thing with this. The risk factor for development of prostate enlargement is age, as one advances in age, previous history, like a family history of prostate enlargement, diabetes and hypertension, because people who have diabetes and hypertension are placed on drugs called alpha blockers. For this particular video, we'll be concentrating on benign prostatic hyperplasia, which is a non-cancerous form of prostate enlargement. Now, people that are at risk of developing the disease are those that are over 50 years of age. The cause is not entirely known, but it is traceable to reduction in secretion of the sex hormone, which is testosterone. As the prostate enlarges, it compresses on the urethra, reducing its size, so there's distortion to free flow of urine from the urinary bladder, like we said earlier. So that might lead to the bladder becoming distended, and then the male starts feeling pain. So let's consider the treatment measure for benign prostatic hyperplasia. One is what we call the wait therapy, where when the patient visits the hospital, it's expected to wait for a period. We wait and watch to see if the prostate enlarges or not. The patient might also be placed on medications called beta blockers, which helps to reduce the size of the prostate. Now, there's also a surgical intervention to this condition. There are several surgeries that can be done. One is traditional transurethral resection, where an endoscope is used to resect the prostate. The second is the use of laser. It's also a surgical measure. Thirdly is a surgical measure that involves placement of stent. The stent is like a suture that is placed in between the prostate to pull it apart, creating a better channel for urine to drain from the bladder. For people that have prostate enlargement, it's advisable that they continually exercise, drink less fluid at night because it's difficult for them to urinate. It is also recommended that they take less alcohol and less caffeinated drinks. The complications that might result from prostate enlargement includes urinary tract infection. Because the urine is retained, there's a possibility of developing infection. Another is sexual dysfunction because of the peculiarity of the location of the prostate gland and the role it plays in ejaculation. One's sexual drive and urge may be affected. I hope this video was helpful. Do share with your friends and family. Click on the subscribe button and the notification bell to be updated on my next post. Thank you.
This city never